Hey, Manrina, so talk to us. What's one piece of advice you can give us this Monday morning?
My piece of advice is to learn to shut up.
Expound on that a little bit. Why is that advice?
I think it's something that I've had to learn as a business owner, and it goes against everything I learned before I was a business owner. So, as a young lady growing up, and then as an associate dentist, I always believed it was important to speak my mind. And if someone had upset me, offended me, done something that felt like an injustice, speak out loud about it. And I kind of pride myself for being that person and doing that. And as a business owner, I've learned that's not always the best way to go. And with your team, if every time they do something wrong that upsets you, like, I don't know, I had someone today send out one of my patients the wrong skincare product. They wanted one product and they sent them another product. And
Mhm.
I was like, why did you send the wrong product? And, they said, oh, they were next to each other. And I think, the old Manrina and the way that I'd been brought up and what I'd always believed to be correct, I would have really wanted to talk about that and explore it and understand it and be like, but how is that an answer to tell me that because they were next to each other? If someone's ordered hydrate lip oil, you send them hydrate lip oil. Why would you send them plant lip? But what I have learned being a boss is it's not my place to then have that conversation. It's just my place to listen and accept and say, oh, no. And that's it. Shut up.
Mm, okay.
It's such a journey for me because it went against my essence of just like really explaining how I feel. And to the point of like, then when you see the person later on and, in the staff room and they say, oh, I'm really sorry about that skincare thing, just smiling at them genuinely back and saying, okay, probably maybe how I was feeling. But I've had to learn this mass suppression of emotion and opinions to just, obviously it's important to take note of everything that's going on around you. I'll make notes and understand what's happening with my team and bring it up at the right time in the correct way. But what's not correct is like my life has been up until now dealing with friends and colleagues that you can just be quite open about how you're feeling, about what's happening at the time.
Mhm. Interesting. So then, how do you know when to bring it up in the right time, in the right way, especially like that scenario?
Yeah. So we have meetings, scheduled meetings with everyone, right? So I have a daily huddle, definitely a group environment. Sometimes I bring things up in a group environment as team learning for everyone, not using a specific person as an example, but doing a reminder saying, hey, we're all going to have a skincare test this morning. What product is this? What does this product do? Let's do a spot test. Does everyone know what's going on here? We have weekly meetings, which are designed to go through these things, which would be a more appropriate place to do the spot skincare test. We have monthly practice meetings. We have monthly reviews for new team members and 3 monthly reviews for team members who have been with us for longer, during the monthly for 3 months, and then it moves on to 3 monthly and eventually 6 monthly. And I also have like different team members with my practice manager, for example. I have a weekly meeting. If she does something, then I can make a note. And in the weekly meeting, if I don't want to make a big deal out about it, then in the weekly meeting, when we're having a one-on-one, I can say, hey, by the way, this happened this week and this made me feel this certain way, and is everything okay? And I guess it's also that it's being like, is everything okay? Rather than getting upset with someone and saying, I don't want to say it, but like, I'm stupid. You're just going to be like, is everything okay? Or, is there a reason why you felt like this happened or these mistakes happened this week? Is there something that I can support you in? And so it's a whole like reframe. You think when you open a practice, everyone might think they're going to be the boss and they're going to tell everyone what to do. But I think it's
Mhm.
almost the opposite. That it's easier to be the boss when you're an associate. Whereas but as a boss, to actually keep a happy team, you need to just very calmly go through anything that goes wrong and then put actions in place to make sure it doesn't happen again. And obviously note everything down. So rather than acting on it immediately, make a note of it and then decide the appropriate actions to take and the correct time to have that discussion. It's not necessarily something that you have immediately.
Yeah, interesting. So then it's almost like as if shutting up is part of the calming down process. Could you think of something in that moment to, I just need to be nicer, but I'm going to tell it to you straight?
Yeah. When like the skincare thing happened today, then I responded and said, "Oh, okay, that's unfortunate that you're not familiar with our students. Read about them and watch all the videos. If you could do that for me, then when I see you next week, I'll schedule a time for me to go through that with you and test you on them, so this doesn't happen again. Could you please send an apology message to the person you sent the wrong skincare to? Arrange for a new one to be sent out, just to let you know the cost of the skincare will be deducted from your wages." So that was my immediate response, which was quite measured and fair, with all the points, what needs to be done. There's nothing emotional in that. It's just very fact. This happened. This is what we're going to do about it. to make sure it doesn't happen again. And this is how we're going to fix what's happened right now. And these are the actions I'm taking because you've done something wrong.
How do they react?
They said, okay, I was going to say you should deduct it from my wages as well. And yeah, sorry again.
Oh, okay, interesting. So then how did this come out to be, Manrina? Like, how did you realize I probably should start shutting up more?
I think it was really early on. I had a nurse and he gave £500 worth of Botox to the lab guy. Like the lab guy came to collect lab work and he picked the lab work out of the fridge and picked up a bag of Botox as well and gave the lab guy my lab work and £500 worth of Botox, which is a prescription medication and useless ones that's kept out of the fridge. And so it couldn't even be returned. And then the lab called and said, oh, you've given us this bag. It's Botox. And I think at the time I was so shocked, like, early bus days. And I'm just like, that's incompetent. I feel like that's incompetent behavior. What do you think about it? And then he was like, oh yeah, I made a mistake, but you can't call me incompetent. That's not allowed. And then I, asked my HR and they were like, yeah, you can't tell someone they've done something wrong. Like say, this is what you are. You could only say to them, do you think that was competent? Do you think that was competent behavior? And so I was like, oh, it's so interesting. Like in normal life, normal conversations up until now, it's just been a conversation that you'd have about this is what you are, in my opinion. But you're not allowed to have that opinion as a boss. You have to ask what their opinion is on their behavior.
Okay, I like that. Interesting.
I think that's where I learned it.
Yeah, no, it's good. So then in the moment of you trying to create this relationships with your team, whether it's like, hey guys, we're a team or we're more than a team, we're friends, right? Or we're a family or anything like that. Where's the line to where you're like, hey, for example, you're really close with the team member and you're like, hey, you know me, right? You've seen my children and everything. But then you decide to be like, oh, I didn't know that offended you, me calling you incompetent. I apologize, right? But then it kind of creates a rift there or something like that. So where's the line for that for you?
I don't have an issue now. We're just talking to everyone very calmly. And I feel like as long as I'm telling them all very calmly and not in a bullying, like, this is incompetent. That's, I would never, I wouldn't say it like that. Anything they do now. Oh, no, did you give the Botox? How do you feel about having done that? What do you think we could do to make sure it doesn't happen again? It's almost quite maternal. It's almost like a family. Or maybe it's like a really nice mom rather than a mom that shouts at people and says, and it's stupid. It's a really nice way to say, oh, okay, this happened. What should we do about it? What can we put in place to make sure it doesn't happen again? But also I'm making out of it. I've got us all over and making out all these things with the date and what happened with each team member. So if we see a pattern and it's recurring, then I've got a series of evidence. And obviously if it's recurring issues, then you need to do something more. It's always calm now. If I don't respond to anything, it's gone. Everything's like, oh.
You ask questions, right, to your response. You're like, oh, why'd you do that? Well, what were you thinking, right, in that moment?
Or if anything, I'd just be like, why do you think that happened? What do you think we could do to stop that happening again?
Yeah, no, that's interesting. So then with that being said, what are some exercises you're doing to remind yourself, especially in the heat of the moment where you're like, what the heck? What are the exercises that you're doing to remind yourself to shut up or be calm?
Yeah. So when I feel myself have an emotional reaction that's not positive, so it's fine when I'm excited when things happen and it's all good and let's celebrate. If something happens, then if I can feel it inside me that I'm like, oh, that makes me want to make that noise. Oh, take a deep breath in. And then I know that's when I need to shut up. So as soon as I feel that, something goes off in my brain and says, shut up, because you're feeling an emotion and better to respond to this when you don't. And there's no rush to respond to anything. So just click it in and say, okay, and then work out how you want to respond to it once that's calmed down.
You started doing this like a couple of weeks ago or?
So my clinic opened just over 2 years ago, and it's been a progressive change, but it's something that I was only conscious that I started doing when I said it to someone this week. I said, oh yeah, when things happen, then I just don't say anything because it's just easier that way. And then I just deal with it when it's the right time. And then I was like, oh, I didn't even realize I started doing that. That's what I do. I don't respond anymore. And I've always been that person that you know how I'm feeling at all times. If I get upset about something, I'll tell you I'm upset about it. And then, 5 minutes later it's done and it's gone and we've cleared it. But I don't tell you I'm upset anymore.
It's so funny. No, and that's awesome. Thank you so much for that advice. We appreciate it. And we appreciate your time. And if anyone has further questions, you can definitely find her on the Dental Marketer Society Facebook group, or where can they reach out to you directly?
Oh, my Instagram is a really popular way to do that. It's Dr. Manrina Rhode, DR, then my name, Manrina Rhode. I manage my own account, so that's a good way to reach out.
Nice. Awesome. So that's going to be in the show notes below. And Manrina, thank you so much for being with me on this Monday morning episode.
Thanks, Michael.